I was diagnosed with ocular melanoma in October 2010, and I had that treated in December 2010 in a hospital in Ireland, and that was done with plaque radiotherapy. After that, we were sent to an ordinary oncologist, and he dealt with we went to him for checkups and scans and whatever. And in January of 2013, they discovered it had spread to my liver. So in Ireland, I had ipilimumab, a course of 4 treatments, and had scans afterwards, and it turned out that that made no difference and a new tumour had grown. The option in Ireland would be to have ordinary chemotherapy, which Brendan had researched and felt wouldn't be good. In this case, it wouldn't be a suitable treatment. So he did some research and found the Spire. The intention was to have Sirtex done, but that didn't work out. I think Dr. Brian Steadman would say my plumbing was wrong, so that we couldn't have that done. But in doing the tests that they had done at that stage, they just discovered that I could have a liver resection.
We were very lucky to make contact with a lady over here called Mandy Chris, and she was the first genuine good experience we had. Great patient empathy. Could identify with us, could identify with what we were going through. The first thing that she suggested to us was that we'd come over for the Sirtex, and the set up to see Mr. Sirtex, Brian Steadman, and we'd read about Brian.
When I first came to meet them, they felt a bit lost and confused. They didn't feel they were clear about the options that are available to them. We took a bit of time and went through where they were at the time, where she was at with her different treatments, and then just talked through the options that were available. Particularly in Belinda's case, Belinda has ocular melanoma, so eye cancer, which sadly had spread to her liver. In that situation, the conventional treatments we use for most cancer patients, that's systemic chemotherapy, so chemotherapy into the vein, is very ineffective. It only works in about 5 or 10% of patients. So 90% of patients will have the treatment for no benefit, and yet they will get all the side effects. Chemosaturation, or DELCATH, is a new technique, and it works by allowing us to treat tumours within the liver with a very high dose of chemotherapy. And the advantage of that is you get the treatment where you want it within the tumours, but you don't get the unwanted side effects of the chemotherapy in the rest of the body, all of which are unwanted and unnecessary. And we can do that by isolating the liver from the rest of the body by using balloons and catheters, and that allows us then to remove the dirty blood that comes out of the liver, clean it through a new filtering system before we give the blood back to the patient. So we end up with the drug where we want it in the tumours, but very little of the drug in the rest of the circulation, and that reduces the side effects related to the treatment.
In our first consultation, I suppose we were apprehensive, but meeting Brian Steadman, he went through absolutely everything, the pros and the cons. He was so honest, and did mention both Chemosat and Sirtex. So we really felt we knew exactly what lay ahead. To come back to the Spire and have the same nurses every time is just so reassuring. We know all about them at this stage, they know all about us, and it's friendly faces, so that's really nice and very reassuring. When I went down for the Sirtex, and that didn't work out, but I did come round still in the theatre, and I could hear Brian Steadman and another doctor discussing what they might or might not do. And the possibility of doing whatever, and the other doctor saying, no, I don't think that would work. But at that stage they realised I was awake, and they brought me in on the conversation and said they had to apologise that it didn't work out, they couldn't do the Sirtex, but that they had other plans, and that was not my problem. I was not to worry about that. They were going to look after that end of things, and I was just to concentrate on getting better. And he would talk to me again at 7 o'clock that evening in much more detail. And at 7 o'clock himself and Professor Ottenar came to the room and discussed exactly what had happened and what they had hoped would happen, which was a liver resection. And we were flying back home on the Friday lunchtime, and the phone rang in the airport in Southampton to tell us they could go ahead with the liver resection, which was fantastic news. That worked out great, and it made such a difference. They were able then to continue to do the chemostat in the Spire because of the liver regrowth. So that was amazing. I've been very surprised. It has been much easier than I thought. Obviously in intensive care, that's not the best place to be. But again, the same faces. And that's just so reassuring to go back in and kind of remember, oh gosh, I remember that nurse from the last time. But they were fantastic there. And then I would think I'd be back on the ward, say the following day, and maybe a day or two later, I would have felt I was back to normal. You know, it was that quick, which was really surprising because I had kind of expected to be, you know, quite ill for an amount of time afterwards. When we would come over to the Spire, we'd be here for probably the best part of a week each time. And we have 3 children at home. We have a son 20 years of age, an 18-year-old, and our daughter is 14. And to be away from them for that amount of time is very stressful for them and for us. And even the thought of coming away for chemotherapy is very frightening. But each time when we returned home, I looked like me. I just had a couple of bruises maybe on my neck. So for them, it was almost like I wasn't sick. I came back home and everything just went on as normal. They just knew I'd been away, but I wasn't coming home like a sick person. I was me. So for them, it's much easier to deal with than if I, you know, had lost my hair or, you know, had other visible signs. So I do think from that point of view, it is a very good treatment. To come to the Spire, they're in the best place. I really do believe that. I believe that everyone that we've come across have been absolutely fantastic and have done more than we'd ever have expected. And I would just say, you know, if that is an option, where we didn't think it would be an option and we're so delighted that it was an option, to go for it, do go for it. You know, in a week, it'll be a distant memory, you know, but the result is amazing.